We use cold therapy with our patients just like you would if you had an injury and you've been told to place ice on your injured part. We use it after surgery to produce this vasoconstriction, which is the narrowing of the blood vessels, and that decreases the chemicals that produce the pain at the nerve endings. It decreases the swelling, and also importantly to me, it helps decrease the postoperative bleeding inside the mouth. The science behind cooling after surgery is similar to what I just said. The concept is to use cold to cause vasoconstriction, or narrowing of the blood vessels to the surgerized organ. And then that decreases the chemical response to trauma or surgery, the decrease in the pain chemicals, the decrease in the chemicals that cause swelling to the tissue, as well as a decrease in the blood flow to the area. The reason we use the AqueCool system as opposed to the old school method, which we used for 20 years up until the AqueCool, which was the jaw bra and the polar ice, is because it was ineffective in the sense that people had to constantly go to the refrigerator and get the frozen peas or the polar ice, and it was inconsistently delivered to the patient, and hence the results were inconsistent as well. We've definitely noticed significant results. In fact, over the years, the 20 years that I've been doing surgery, the AqueCool has given us the greatest results of any other additional technology that we've tried over the years. And the three biggest or most dramatic changes we've seen with the AqueCool are, number one, a decrease in the pain following surgery, which is greatly beneficial to the patients, a significant decrease in the swelling, and most important to me is there's been a decrease in the post-operative oozing or bleeding. When I come in to see my patients the next morning after the surgery and examine their mouth, the surgeries are all done intraorally, the mouths are usually clean and healthy and no signs of blood. And that's in contrast to before, where you'd come back and there was always lots of blood and clots inside their mouth. Today, I come and I hardly see any. And so it's been a very dramatic difference from my perspective. Yes, the patients have been very satisfied because their main interest when we talk to them about their post-operative recovery is they want to reduce the pain and they would like to reduce their swelling. And we simply tell them that today the best way to achieve those two goals is to use the AqueCool compression device. Well, what I like the most, as well as the caregivers and the nursing staff, is simply the convenience. Because it's so easy to use, you simply put it on and turn it on and everything else takes care of itself. And that's in contrast to the old school method where we had to use the jaw bra and polar ice. They were constantly having to deliver little bags of ice to the patient. When I would come in the next morning, generally speaking, most of the ice bags would be sitting on the table and they all would be warm. So it was difficult for them to circulate them through the freezer department. The patient's biggest considerations are themselves, in the sense that they will do pretty much anything to help reduce their pain and their swelling. So once they understand that the AqueCool is the best mechanism to help reduce their pain and swelling, they will choose it pretty much every time over the old school method of the jaw bra and polar ice. I think the patients are more than willing to pay for the device to help decrease their pain and swelling. Our patients are given the choice between the AqueCool system, which is not reimbursed by medical insurance, or the old school system, which is provided by the hospital, which would be the ice bags. So that's provided free. But pretty much 100% of them, when they understand the benefit, will choose and pay for the AqueCool device. The AqueCool system is not difficult for the patients and the caregivers and the nursing staff to use. We generally place it on the patient while they're asleep in the operating room and pretty much leave it on until the next morning rounds. And that's when we take it off and show the nursing staff and the caregivers how to place it back on, how to change the water in the reservoir, and check the temperature setting. But it's very easy to use, and there have been zero problems with the nursing staff and the patient caregivers using it. Our standard of care throughout myself as well as the industry has been the use of jaw bra compression devices with the polar ice packs, these blue ice packs that you put in the freezer. And they only lasted about a half hour, and you had to put in another one. So that meant you had to have at least 20 of them in the freezer. and this had to be someone changing them every half hour. Well, that's a difficult task for the hospital staff as well as the caregivers at home. They generally just had a hard time doing it. When I would come in on the rounds the next morning, by and large, almost 90% of the time the ice bags were warm and laying all over the bed, but no one would put them back in the freezer or change them. So it was very ineffective. And when the AqueCool came along, it made such a vast difference. We were using it quite readily. Most surgeries are, medically covered, but it hasn't been a problem getting the patients to accept the fact that the AqueCool is not a covered benefit. They understand that they have the choice between the old school jaw bra and polar ice, or they can pay out of pocket for the AqueCool. And knowing the biggest benefits are pain and swelling, they pretty much choose it every time. Well, my message to other doctors who are not using it, who are using the old school compression device, is that this has been a huge benefit. In fact, of all the things I've added to my practice of surgery over the years, this has shown the greatest benefit to the patients, the caregivers, and myself. It's had a huge decrease in patients' pain after surgery, the swelling after the surgery, and most remarkably has been the postoperative bleeding. Those three things have made a dramatic decrease and have benefit for the patient. So I would highly recommend it to other surgeons who are doing facial reconstructive surgery. The top 3 reasons I would recommend the AqueCool to other doctors would be, number 1, the patient's decrease in postoperative pain. 2 is a significant reduction in postoperative edema and swelling. And thirdly, which is the most surprising, has been a decrease in postoperative oozing and bleeding. There's actually almost none after the surgery. When we go back and look at the patient's mouth, they're extremely dry and clean and hardly any oozing at all. That's made a big difference. Both the hospital staff as well as the caregivers simply like the convenience of the device. You simply put it on, fill the reservoir, turn it on, and then there's little to do with it throughout the day, as opposed to the old school ice packs, which had to constantly be changed and tucked in and were quite uncomfortable.